how health insurance reform affects employers. Let's now shift a moment and talk about health insurance reform and its impact on employers, and then we're going to talk about health insurance reform and its impact on employees. Okay, the first item for employers is that when you used to sit with an employer, particularly if you had an ERISA plan, those of you who follow the Wall Street Journal, there was a great interview this week with the CEO of Aetna, who basically went on national television and the front page of the Wall Street Journal and said, you know, it was really unfair for President Obama and all these people to criticize us as carriers. Most of what we do at Aetna, and more than half of the employees in America, their insurance doesn't come from an insurance company, it comes from their employer. They're self-managed, self-funded plans. We at Aetna, we just administer what the employer tells us to give in benefits, and we became the scapegoat. It was a very key point. Well, all that goes away, because starting 2014, and really starting now in renewal of plans, the federal government now dictates your health insurance. The federal government says no lifetime maximum benefits. Preventative care has no copay and deductible. Your employees may say, I want to pay $1,000 less in premium and pay $100 a doctor visit when I go for my mammogram. Not a chance. All policies must be zero on preventative care. And let me tell you, HSS Secretary Sebelius, she keeps the list. The list is up to 5,000 items that lobbyists have put on the preventative care no-cost list. And if you make any kind of preventative care product as a medical provider, you want to get it added to your list that carriers must cover. There's now a federal minimum on benefits, which is really a maximum. In effect, the federal says you must cover pregnancy, you must cover this disease, you must cover this generic pill, you must cover this pill. The federal government has, in effect, come up with a formulary that they control at HHS, which defines what all health insurance is. And where in the past you used to sit with an employer and say, do you want coverage for this? Do you want coverage for this? Do you want them to pay $50 when they go for an annual checkup? Do you want them to pay for obesity? Wrong, wrong, wrong. The federal government now sets a minimum benefit list that frankly is so rich, it makes Massachusetts policies look poor, those of you who are up in the New England group. It's going to be very expensive, and there's no way out. All policies, personal and group, must cover the federal minimum, which is really the federal maximum, because no one can afford to give any more. This is the law. I know I sound like I'm politically saying this is bad. I'm telling you this is the law now. And policies renewed after September 2010, that's next month, must cover the new federal mandate. If you're an employer and you're larger than 50, you must offer health insurance. Let's say that again. If you're an employer with more than 50 employees, the federal government says you must, M-U-S-T, offer health insurance. Well, what are you going to do to me if I'm not? You're going to arrest me? No, we're going to give you a penalty. Okay, what's the penalty? The penalty for not offering health insurance for a whole family is $3,000 an employee. Really, $2,000 an employee, but a max of $3,000 for anyone getting exchange subsidy. Let's say this again. If you must offer health insurance, the health care reform bill in the press says, and if you don't, you'll pay the penalty. What penalty? Well, the penalty is a maximum cap on the penalty of $2,000 for all employees, or $3,000 for each employee who goes and gets subsidized health insurance. We'll talk about in a minute. So think of that. I'm an employer with 100 employees. Health insurance for a family under these new mandates is about $20,000 a family, about $5,000 a person, and that's probably cheap. So if health insurance for a family of four is $20,000, and I don't offer it, even though I must, the penalty is $2,000. Could someone do the math on that, please? You mean I saved $20,000 not offering health insurance, and my max penalty is $2,000? Actually, $3,000 but capped at a max of $2,000. That's not a penalty. That's a gift. Woo-hoo, says the employer. I'm getting out of here. I'm not going to give health insurance. So fast. You don't give health insurance, Mr. Employer. Your employees will quit. Oh, they need health insurance. Well, tell me what will happen to them. We'll cover that in a minute. Under 50 employees, no penalty. So if you're under 50 employee company, there's absolutely no penalty for not offering health insurance. And you're going to see in a moment your employees are 22 times better off dollar-wise if you don't offer them health insurance and you're a small employer. And we'll show you that in a second. So assume that health insurance, so in these numbers I said $6,000 a year. So the White House wanted a $10,000 employer penalty per person. So think about that. What they wanted, it's very important when you study this to understand what they were trying for in Congress, what they passed. Why? Because things could change in the future, or you're going to have to sit with clients who are going to go, that's crazy. I mean, right now, the people on this call, there's quite a lot of you, are going to have to sit with an employer who's going to say, tell me that again. You must offer health insurance. Okay. How much is health insurance? $20,000 a family. Okay. And what if I don't? Are they going to arrest me? No, you have to pay $2,000 a person, $2,000 an employee for a whole family of not offering them health insurance for 20 grand. Now, the employer is going to go, that's crazy. Why do they mandate I do it but only give me a penalty of $2,000 when I save $20,000? And, of course, this is what you need to explain. The White House, led by our president, wanted a $10,000 penalty for an employer. They wanted to say if health insurance costs $6,000 a year per person on average, and by the way, we spend about $10,000 a year right now in the nation. If you took our $3 trillion health care bill divided by 300 million people, it's about $10,000 a person. So health insurance for a working, healthy person is probably about $6,000. Now, the White House wanted to charge employees $10,000 a person, family of four, $40,000 if the employer doesn't supply health insurance. And the Senate said, that sounds good. But then when they got to the detail, I heard from constituents, business after business said, you think I have 800,000 employees in India now? Watch me have 2 million in India. I'll close every plant in the U.S. I'll close my law firm and move it to England. I'll close this and move to China. So one by one, the employers lined up and said, if you make us spend $10,000 penalty on health insurance or give someone who doesn't have it for $6,000, we're closed. We only pay a lot of employees in this country. Anybody like lunch or dinner, go to the restaurant. They only pay those people $6 to $10 an hour. How can they afford to give them $12 an hour in health benefits on top of an $8 salary when they're competing with another restaurant? I mean, the economy would have collapsed. So what happened is the health insurance penalty was originally supposed to be $10,000 per employee if you don't get it. The Senate lowered it to $750. The House came up with a $2,000 penalty, and net, that's what we got today. We got the House version. Nobody's happy with it, but what really happened is we started out to do health care. It was a multi-year process. Something showed up bigger than health care called unemployment. Any of you poker players, unemployment trumps health care. Unemployment trumps health care. Unemployment trumps health care. Sorry I have to repeat that, but in doing this bill, we decided not to close the working factories and businesses in America just to get health care, which means that, in effect, an employer today, you're going to see in a moment, gets out like a bandit if they don't offer health care. Now, let me deviate a moment and talk about how health insurance reform affects employees. Then we're going to come back to how it affects employers. First, as I mentioned before, all personal policies and all group now have mandated benefits. They have no lifetime maximums. I can't figure how many of these carriers stay in business because I work with them most of my career, and there's something called Lloyd's of London, Arabank, those are the reinsurers. And in order for these companies to exist, they have to have some limit on benefits. We now have federal law that has no lifetime maximum benefits, and if you work making a product for the ICU in a hospital, you just hit the jackpot here. Because one of the things we stopped operating on people and frankly let them go at age 92 after operation on indigent people was there was $1 million limit. No longer $1 million limit, no lifetime max. Preventative care I've already covered, no copay and deductibles. The federal minimum benefits. Now the individual mandate. We actually have a good individual mandate. The individual mandate says you as an individual, whether you work for an employer or not, must buy health insurance. And if you don't buy it, we're going to tax you a penalty of the cost of buying it. I mean, it's brilliant. You go buy health insurance. It's $2,000. You don't buy it, we'll tax you $2,000. Probably better off buying health insurance. So we have an individual mandate, although it's heavily subsidized, as you're going to see in a moment. Here's the subsidy. And I don't have time to put the whole chart out, but here's how it works. And if you look here in the middle column, expected total cost, $24,000. So $6,000 a person, family of 4, health insurance is $24,000. That's the actual cost for all the families in America of 4 on health care. And again, nationally, we spend $10,000 a person, or $40,000 a family. I'm saying this family of 4 because they're working only spends $24,000 on average. Now, when you go to buy health insurance and you have income of let's use $40,000. Let's look at the middle line here, $40,000. The maximum premium, if you buy it through the exchanges, we're going to cover a moment, of an individual policy under federal law is 5.4% of your income, $2,178. So think what I just said. You're a family of 4. You go to buy health insurance from any carrier in the U.S. expecting a cost of about $24 grand. When you go to buy it through a state-sponsored exchange, the federal government will pay $22,822, the column on the right. You will pay $2,178, and you just got the biggest windfall. If you earn $80,000 a year, it's capped at 9.5% of your income. You get a $15,000 subsidy. We're not talking about a subsidy that's paid after tax. We're talking about hard cash paid to you each week. You go buy that premium, and the carrier can say, all right, you pay me $2,178, the middle line on annual premium, and I will get from the federal government in cash $22,822. Or if it's through an employer, in exchange, I'll take it off wage withholding. The point is, the federal government pays it each week. So you see what's happened. We put in massive individual premium subsidies. For every individual, whether they work for a company or not, they get heavily subsidized health insurance, and anyone earning $20,000 or less, actually it's higher than that if they have a family, they're going to get free health insurance from a personal policy. This is going to explode the personal policy market because everybody can afford health insurance provided they earn less than $88,000 a year. Next, what does all this mean? We just covered how personal policies are going to drop in cost to pennies, $2,000 a year, $1,000 a year for a family of 4 based on their income, as high as $7,000 a year, but you get $24,000 worth of health care. Employers will pay a $2,000 penalty if they don't offer. An employer basically, which you're about to see, can offer $24,000 worth of coverage to a family of 4, even if he gives the employee the money to buy it for $4,178. Let's go through that specifically. A typical employee earns $40,000 with a family of 4. The employer can pay $24,000 a year, $6,000 a person for qualified health insurance that meets the federal minimum. This is what the press still thinks is going to happen. Employers are going to have to pay health insurance that covers pregnancy, no deductible care, all kinds of great stuff. 2, or the employer can pay the $2,000 penalty and give the same employee $2,178 and say, buy $24,000 of health insurance. How do I buy it? You go find an agent, or you click here on the state website. Wow, what's the policy? Includes everything, much more than the old corporate plan. 0 deductible when you see a doctor on hundreds or thousands of items. Great policy. Can't be canceled. Max cost $2,178. What if I get laid off? Oh, we lower the salary to 0 if you're laid off, and you get to keep it. This is the law now. So option 2, what would you pick? Identical coverage from the identical network and carrier, because the federal government's now defined the network and defined the benefits. The employer gets $24,000 worth of coverage for his employee for $4,178. And this scales between $2,000 and $8,000 depending on how much income the employee earns. What would you do if you're an employer? Employer gets $24,000 of coverage for $4,178. See it right here. $2,000 penalty the employee pays. I don't call it a penalty. I call the employer penalty the employer contribution to those who can't afford health insurance. $2,000. 2, $2,178 is paid through an HRA. Give the employee an HRA that says I will pay up to the cost of your share of the premium, $4,178. And take a look at the numbers here now, as I showed you in the chart before. If you have income of $80,000, your annual premium is capped at $7,600. You could have $24,000 worth of health insurance and a massive government premium subsidy. In effect, if you're an employer, you're really screwing your employees unless you do this, because they get permanent coverage from a personal plan that's better than anything you could come up with.